Okay? So here's the question. Let's say someone is having a heart attack, they're keeling over. Oh, I don't feel too good. At this point, in everybody's mind, I need to give this patient an aspirin. My first question is, do you medicate? Are you the person who medicates? Most of the time, I don't think that many people have taken a MAT, which is the medical administration training that you can actually take to be able to administer medication. So the first thing I want to be very clear is you're going to give this aspirin to the patient so that the patient can auto-administer, can self-administer that medication. You're not medicating anyone, nor will you be writing that down anywhere. Be very clear on that. Number two, I just want to be very clear also. You want to ask some questions before you give any medications. What do you think you should ask? Are you taking any other medications? What we're listening for are blood thinning medications. Any other medications any other of these medications that may be out there that may help this person circulate the blood in a better fashion. So in this case, you want to make sure you ask an open-ended question. Don't ask, are you taking any blood thinners? Don't ask that. Just, are you taking any medication? Always when it comes to meds, ask an open-ended question. Let them let you know. Yes, I'm taking this. That's for my cholesterol. I'm taking this because I get migraines all the time. I don't know what's going on. I don't feel too good. All right, I take this for my diet, so on and so forth. I take multivitamins. Whatever it is they take, you want to take all of that into account. But if there's anything that has to do with blood thinners, you don't want to, on top of that, give them an aspirin. Why else would you not give somebody aspirin? Well, you also thought of it when it comes to allergies. We want to try to be careful. If I'm on the phone with Dr. Jones, my uncle's keeling over. I know you told us that he's allergic to aspirin, but I think he's having a heart attack. All right, can we give him the aspirin? Believe it or not, 9 times out of 10, you know what the doctor's gonna say? Give him the aspirin. We'll deal with the allergy later. Because the minute this person goes into a sudden cardiac arrest, it's going to be a lot harder to bring this person back. By the way, I have bad news again for everyone. The minute you find yourself conducting CPR or compressions on someone, that is a very gray day. Because truth is, if you ever find yourself conducting CPR on a patient, chances of survival for that patient at that point are 12%, according to the American Red Cross. The incorporation of an AED, automated external defibrillator, brings it up to 35% survival rate. So I just want to put it out there to everyone. Please keep in mind, right, when it comes to giving any medications, it's okay to also call that patient's doctor. Upon the doctor's direction, you may find yourself still giving them the aspirin, but you're already on your way to the ER. Why else would we not give somebody aspirin? Why would you say? What if that person has internal bleeding or ulcers? So just to put it out there, aspirin on the street, we know it to be a blood thinner, but it's actually an anticoagulant. It has the ability to remove portions of the plaque that build up. So therefore, yes, you want to have this patient take the aspirin, but you first have to ask these questions. Any history, family history of internal bleeding or ulcers, any issues in regards to blood thinners or any medication you're taking, right? Whether there is a known allergy to aspirin. These are questions. And lastly, obviously, is the patient conscious? Can you give this aspirin to this patient if they cannot swallow? All right, so let's go back to the aspirin, right? What would you say is the proper dosage? This is the million-dollar question, right? What dosage of aspirin would you give a patient if they're having a heart attack? Let's talk about that. One baby aspirin would be 81 milligrams. What you want to do is give them a minimum of 2 baby aspirin, which means it would be a minimum of 162 milligrams, all right, to 325 milligrams. And I'm going to be honest, the best type of aspirin to give would be the sublingual that is able to dissolve and be better absorbed by the body as soon as it is administered. So please keep these in mind. Will this be sort of what we call a shot, a clear shot, a bullet to cure this person? Thus far from it. You're immediately still going to the hospital to have this patient undergo a number of tests so that we can help this patient at that point. Please keep in mind, right, every person is different. Every person sees different symptoms. Do not ignore symptoms when it comes to a heart attack. A heart attack can be devastating. And sadly, once that person goes into a sudden cardiac arrest, again, secondary to a heart attack, please remember, it is not going to be easy to bring this person back. And so that leads us to now further speak deeper into what we call sudden cardiac arrest and the causes of a sudden cardiac arrest, which actions we should take. When you incorporate the automated external defibrillator, what is that able to do to help bring this person out of what we call a sudden cardiac arrest? And then moving forward, what approaches should we take as far as alerting? So please, please, please keep these topics and keep these points in mind as you are trying to help this patient when it comes to a heart attack. Thanks guys for watching. Hey, we're here teaching everyday people how to save lives.